All right, Tiffany, how are you doing today?
Fantastic.
So we're here today to demonstrate fractional technology here at our clinic, Infiniskin Cosmetic Associates. Tiffany works here at Infiniskin. She's also had a couple of Fraxels done before. I think this is your third or fourth one. This is Jennifer Swank, who's our main esthetician and laser technician. She has a lot of experience doing Fraxel, probably on the order of at least 700 or 800 Fraxels, so very experienced. We've done Fraxel for about 5 years here at Infiniskin Cosmetics since its inception. And here's what I can tell you about Fraxel. It's an amazing advancement in the world of skin resurfacing. Previous to Fraxel, the only tools that we really had as physicians to really get rid of acne, scarring, and wrinkles in the face was a more traditional approach to laser resurfacing, such as erbium laser resurfacing or CO2 laser resurfacing, where we actually had to burn all the skin off someone's face in one fell swoop to really rejuvenate the skin or burn down the wrinkles or burn down the acne scarring. Now, with the advancement of fractional technology, we really use these same laser wavelengths. So we still use CO2 or erbium wavelengths, but instead of doing everything in one fell swoop, where we burn off all the skin, where you have a lot of downtime and it's kind of scary for patients at times, we can now do it and break it down into mini micro segments of resurfacing. So that's what fractional stands for. Fractional is basically resurfacing the skin, but in small, mini fractional approaches. We do this by running the laser over the whole face, but the laser is actually only partitioning up the skin. So it's shooting hundreds of thousands of tiny little dots in the skin as we go across the face. In one fractional resurfacing procedure, Jen, I think that our machine might only resurface what?
20-25% at a time?
Yeah, maybe 15 to 25% of the surface area of the skin. So what you're left with after one fractional procedure is about a 15 to 25% resurfacing procedure. So that's going to be about 15 to 25% of the results that you would have had with a more traditional downtime, full-blown laser resurfacing. So then what we do with Fraxel is we bring the patient back about 3 to 4 weeks later, and we do another one. That's the minimum amount of time that we like to have in between. You could have a month or two, whatever fits into your schedule, but the minimum amount of time for skin healing in between these treatments is about 4 weeks. So over the course of 4 to 5 Fraxel treatments, with getting 15 to 25% each time, you're going to get a very good approximate 75% total resurfacing at the end of your treatment sessions. So don't expect Fraxel to make it all happen in one treatment, but patients usually get a very nice insight even after the first treatment with that 15 to 25% result. Was that your experience with your first couple?
Definitely. After the first week, I noticed a huge difference in the texture of the skin. And then I think probably about a month later, I noticed tightening overall, kind of tightening, fine lines were kind of disappearing, and
kind of plumper.
Plumper. It just had a plumper, nice, smooth effect. Definitely. I love this treatment. Yeah,
that's probably the most descriptive terminology that my patients give me for feedback after having Fraxels is that their skin feels polished. Mm-hmm. They just feel like they have a luster to their skin that they haven't had for 10, 12 years. It really does give you that. It's essential, to resurface the skin over time as it starts to age, because what happens is the skin, not only does the texture and the outside of the skin start to lose that more youthful shine and luster, the way that light reflects off it and such, it also loses its collagen production. So Fraxel really gets in there deep and creates a deep heating in the upper epidermal and the lower epidermal and the upper dermal layers of the skin to stimulate it to start to produce collagen. It tells the skin to wake up, to keep growing. So it's very healthy for the skin to undergo this it's kind of a punch to the skin saying, hey, you're not done growing, let's keep working for this patient. So what we're going to do today is really demonstrate the most mainstream type of fractional technology there is, and that's the original Fraxel laser, which Jen will show you in a few minutes. And now in the marketplace, there's of course a lot of different companies that have come out with fractional lasers with different sexy, alluring names on them. Pixel, I don't know, what are some of the other ones? There's probably 5 to 10 different ones. Now the thing you have to be careful about with laser resurfacing, and especially Fraxel resurfacing, is that a lot of these lasers are spa grade lasers and not true medical grade lasers. Here at Infini, because we are staffed by myself, who's a physician, and I'm always on staff here at the clinic when we're doing these procedures, we use true medical grade settings. So we use very strong settings. There may be a couple days of downtime with each treatment because of that, and Jen will talk a little bit more about that later. You have to compare apples to apples, because if someone gives you a treatment that's too fluffy and you only paid a small part of the price, you kind of get what you pay for, so to speak. If something sounds too good to be true, that there's no downtime,
right.
It's just quite...
I hear that a lot. They've already had it and they didn't use numbing cream and there wasn't really any downtime, just a little right afterwards. I know they didn't have true fractional because there is some downtime involved.
Yeah, if you're going to have a true medical grade Fraxel treatment, we usually do it with a little bit of sedation, with some oral sedation, just to take the edge off and take the pain relief away, because you just cannot give someone really definitive good results without using strong settings. And along with strong settings, there's a significant amount of heat delivered, therefore some swelling and a little bit of discomfort. We here at Infini have done this for 5 years, so we really feel like we have the best formula down to keep these side effects to a minimum and really help patients recover quickly. And we'll talk about that as we go along here and give you a little more insight into that. So we're going to get going here soon, and I hope you enjoy things.
Okay, now that we're done, a couple things. Just make sure that you wear a hat and your sunblock, at least for the next 7 to 10 days. Although if you spend any amount of time outside, you should do that always, regardless of getting a Fraxel procedure. Can you tell us a little bit about your pain level?
You know what? It was the first couple passes were really okay. Towards the end, it did get a little bit sensitive in some areas, probably right here and around the edges, but nothing that I could not tolerate.
Yeah, she handled it very well.
It went pretty quick. I was very surprised.
And how does your skin feel right now? Like a little bit of a sunburn?
Yeah, it feels pretty warm, but really putting that gel in the refrigerator and putting it on, it feels nice afterwards. So right now it just feels warm, but nothing too bad or anything like that. I'm definitely going to come back again and get one. So
you can see this is typical of what you look like when you're immediately done with the Fraxel. And tomorrow, this bright red will kind of turn to a bronzy, a little bit darker like a tan, and slowly will fade away over the next 4 to 6 days.
yes, thank you so much.